We are live today at Reflection Eternal Barbershop, located here in Baltimore. Today we will talk about prostate cancer. What is the prostate gland? How it's treated? Who's at risk? As well as other aspects.
What is the time that I should be concerned in reference to going and taking the test? What should make it happen? If I didn't pee straight one day, if I peed from the left to the right one day, I need to go take a test. What constitutes me that I need to go get my prostate taken?
That discussion should start at 45 for black men, 45 to 50-ish for white men. Now, men who have a family history, several of these organizations, not all 12, but maybe 3 of the 12 say, if you have a relative who was diagnosed at 47, you need to start thinking about it at 37.
Yes. Is it like the paternal line or the maternal
Both.
line, like your uncle?
Yeah.
Okay, most of those.
I heard a doctor on the radio say that 2 years ago that if you don't have these certain symptoms, don't go get tested.
Most cases of prostate cancer, even if it's aggressive, and it's early, as Dr. Burnett says, may produce no symptoms at all. So no pain anywhere, so it can be a silent disease early on.
I have an enlarged prostate because I started going to the bathroom constantly, 5 times an hour, sleep good at night. Now I do, but my urologist is stressing me that he put me on Flomax and something else, and he's putting pressure on me to get a UroLift.
I have, for the longest time, told patients who come to see me, you should get a second opinion. It's not that I am not confident in what I said, it's just that, and I think that every patient, before they get any major procedure, should talk to at least 2 doctors and get at least 2 different opinions.
How common is prostate cancer compared to other cancer types?
Well, there's a number of studies that suggest that perhaps 1 in 7, 1 in 8 men can be diagnosed with prostate cancer. That's the bad side. The good side is that it's only about 1 in 30 men who actually die from prostate cancer.
How is a prostate exam even performed if it's so hard to get to? Instead, it's buried in the burrows of the pelvis.
Well, I can speak to that. The prostate gland is accessible for a clinical examination by a physician with a gloved finger that placed in the rectal canal can actually feel the prostate, which is just in the pelvic area, but access to the prostate can be immediately achieved by this sort of approach.
What are you feeling around for when you're feeling around the prostate?
Well, what we're feeling for is what we understand is the normal texture of the prostate and the size of the prostate. If there are any abnormal shapes of the prostate. Prostate cancer, we get concerned about if there really is something that feels hard and irregular about the prostate.
So they like numb it up or anything, or you just go right in?
Yeah, there you go. I got a reaction for the crowd.
It's quick, and then it doesn't hurt anything.
We use a gloved hand, there's a lot of lubrication, and there are ways to position the patient, kind of putting their chest down maybe on a table and having them relax, take a couple of breaths, and being expeditious about it, you're not being in there for half an hour.
We see these commercials on for Walmart late at night, prostate, go ahead and relieve your prostate, take these prostate pills, and you can have a better urine flow and all these. Do these things help?
From a urination standpoint, I think there's a lot of stuff in those things that nobody understands if they really help or hurt, and there's been products that have estrogens in them and things like that. But things like saw palmetto, I think it's reasonable to think that saw palmetto could potentially help with urination.
I really got a colonoscopy. What it is?
Colonoscopy.
And I was thinking, but they took some lesions out of me, some little small
Polyps.
Polyps, right?
And I was thinking that it was kind of checking the prostate too. I don't even know why I was thinking that, man.
Because it goes up the same canal.
Yeah.
Yeah.
But it's a different assessment.
Yes, sir.
It's different.
So to get the PSA, I have to ask for that when I see my doctor.
Yep. Many men think because they had a colonoscopy, their prostate's been checked. And that is not true. That is a myth that's out there.
Is there something that we can do as far as eating something healthier foods or something like that?
Try to get some exercise. 4 times a week for a half hour of moderate to heavy exercise actually prevents a lot of disease, including cancer and heart disease and hypertension and diabetes.
Other than Hopkins, where do you go to get good treatment at?
Going to the right place is so right, though, because we're fortunate in Baltimore. I can speak this way because Hopkins is good, Maryland's good. There are a number of places that are good. But you know, in my work in studying how things are treated, people who are middle class, it's really socioeconomic more than race. People who can go to the right place get treated with the new modern higher energy linear accelerator. People who don't have money and don't have resources or are not motivated to travel a little further, which is also a problem sometimes, they get treated with the stuff that was modern and state-of-the-art 25 years ago.
A man's sexual activity plays a difference in if they get prostate cancer or, or if they don't get prostate cancer.
I actually once saw a paper that said the more sexually active you are, the less likely you are to have prostate cancer. Now let me try to put that genie back in the bottle. The answer to your question is nobody knows. Yeah.